All right, so you sent over some pretty interesting stuff about this flu season, and looks like Louisiana is sticking out a bit.
Yeah, seems like something a little strange is happening over there.
Well, we've got this article from Ars Technica that lays it all out, and then someone posted it on Reddit, so we get all the public reaction to it too.
Oh, that's neat. Yeah, so we can see what people on the ground are saying as well as the hard data.
Yeah, and so the main question here is why Louisiana's seeing this big jump in flu activity while everywhere else seems to be having a pretty normal flu season.
Especially since they've hit that very high level, on the CDC's scale. It's like 13 categories for influenza-like illnesses.
Like LIL, yeah.
Right, ILI.
Mm-hmm.
And most other states aren't even close to that level.
Yeah, and Oregon's the only other one that's reached that same level, so it makes you wonder what's going on in those two states that's so different from everywhere else.
Right, because very high for ILI means a big chunk of the population is showing, those flu-like symptoms.
Which brings us to the second part of this whole thing, the Louisiana Department of Health's policy on, promoting vaccines. What do you think about this?
Well, it's definitely interesting, that's for sure. From that Ars Technica article, it sounds like they've really backed off of promoting flu shots and even COVID-19 and Mpox vaccines, too.
And it's not just like people guessing. The article talks about canceled vaccination events, and all their social media is only about hygiene, nothing about vaccines, which is a pretty noticeable change.
Yeah, does make you wonder what's behind this change. Their statement said something about moving away from one-size-fits-all paternalistic guidance, which is an interesting way to put it. Have you ever heard public health messaging described like that?
Not really. Like, isn't the whole point of those messages to steer people towards, making healthy choices?
Yeah, that's usually how it's been done. But maybe they're trying to, emphasize personal responsibility and letting people decide for themselves.
But it seems like they're only applying this to seasonal vaccines. That article quoted their statement, and they made sure to say that childhood immunization policies haven't changed at all.
That is weird. You think that paternalistic guidance idea would apply to all vaccines, right? Or
You'd think so, yeah, especially since a lot of childhood vaccines are required.
it's almost like they're saying adults can make up their own minds about vaccines, but kids can't.
Yeah, it's definitely a head scratcher. And the people on that Reddit thread are having a field day with it. You've got everything from people who just don't believe it to some who are really mad and some even joking about it.
Yeah, I get it. It's a big change, and it could have some pretty big consequences.
And there's definitely a lot of irony in those comments, especially the ones pointing out how much federal funding Louisiana gets.
Oh, yeah, the whole welfare state thing comes up a lot.
Yeah.
People are saying it's hypocritical to rely on federal money, but then ignore federal health guidance.
Basically, they're saying you can't just pick and choose which parts of the system you want.
Exactly. It shows that tension between, individual freedom and responsibility to the community, which comes up all the time in these public health debates.
And beyond, the initial reaction, there's a lot of worry about what this policy means in the long run.
For sure. A lot of the comments are concerned about how this will affect the most vulnerable people, the possibility of deaths that could have been prevented, and just a loss of trust in public health institutions.
Some are even connecting it to this bigger trend of, anti-intellectualism and not trusting experts. They see this as part of a larger shift in society.
That's interesting. Makes you wonder if this is more than just a flu season thing. Could this be a sign of how public health messaging is going to change in the future?
That's a scary thought, and we'll definitely get into that more later. But first, let's see how Louisiana's situation compares to what's happening in the rest of the country.
So we've got Louisiana kind of doing its own thing with this flu surge and the health department not really pushing vaccines.
Yeah, it's definitely got people talking, and a lot of those Reddit comments show that people aren't too happy about it.
I can see why one commenter mentioned herd immunity, which is something we should probably explain a bit.
Yeah, okay, I remember hearing about that back in school. But could you give us a quick, refresher?
Sure thing. Herd immunity is basically the idea that when you have enough people in a community who are immune to a disease, whether it's from vaccines or they've already had it, the disease has a harder time spreading. And that ends up protecting the people who can't get vaccinated, like babies or older folks or people with weaker immune systems.
So basically, the more people who are vaccinated, the less likely anyone is to get sick, whether they got the shot or not.
Exactly. It helps everyone. And it's really important for those vulnerable groups who can't build up their own immunity as easily.
Which makes what's happening in Louisiana even more worrisome. The article said there have already been 4 flu deaths in kids this season, and they're the ones who really need that herd immunity to protect them.
Yeah, it's a harsh reminder that these public health decisions have real consequences.
Yeah.
And if we don't get enough people immune, it can put those vulnerable folks at serious risk.
And it's not just flu we got to think about either. The article mentioned that COVID cases are going up again too, so that adds another layer to this whole thing.
Oh, for sure. It's
Yeah.
like we could be looking at a double whammy of respiratory illnesses hitting at the same time, which could really overwhelm the healthcare system.
Especially since the Louisiana Department of Health isn't doing their usual vaccination events and clinics like the article talked about. Those events often reach people who don't have a regular doctor or who really rely on those clinics to get their flu shots.
Yeah, it's all about access. Even if someone wanted to get vaccinated, if there aren't any easy ways to do it, that creates a hurdle, especially for folks in lower income areas.
And on top of that, you've got this shift in their messaging. Instead of really pushing vaccines, they're focusing on hygiene. I
Yeah.
mean, yeah, washing your hands is important, but it's not a substitute for a flu shot.
No, it's not. And that shift in messaging could actually make things worse. If people are hearing less about vaccines and more about just keeping clean, they might start thinking that's good enough, and it's just not.
It's like trying to put out a fire with a squirt gun when you have a fire hose right there.
Exactly. And not being clear about vaccines just leads this gap that gets filled with misinformation and confusion. It's kind of what we saw in those Reddit comments.
Yeah, you had people throwing out conspiracy theories and questioning why they're doing this, and just a lot of anxiety about the whole situation.
Well, yeah, it's a natural reaction when you're not sure what's going on and you don't have clear information. And the problem is when you don't have that guidance from trustworthy sources like the health department, people will go looking for it in places that might not be so reliable, which can be dangerous.
And this isn't just about this one flu season, is it? Some people were worried that this is how Louisiana is going to handle all public health issues from now on.
I can see why they'd think that. If the health department doesn't want to promote something as basic and proven as a flu shot, what does that say about how they'll deal with more complex health issues down the road?
Makes you wonder if this is just the beginning, a move towards putting individual choice above what public health experts recommend.
It's a possibility we have to consider, and it could have huge consequences for everyone in Louisiana's health and well-being.
It seems like people aren't just sitting back and letting this happen in Louisiana.
Yeah, there's definitely a lot of pushback against the health department, and they deserve it.
I was surprised by how many of those Reddit comments were saying people need to do something about this.
Yeah.
Sharing that article, contacting their representatives, encouraging others to get involved.
That's good to see people are taking this seriously and not just letting it slide.
That kind of, grassroots action can really make a difference.
It absolutely can. And it's not just online either. That Ars Technica article mentioned some healthcare workers who are speaking out against this policy too, both within their own circles and talking to the media.
Makes sense. They're the ones dealing with this firsthand, seeing how it's affecting people. They're in a unique position, and it's kind of their duty to stand up for their patients.
Exactly. They have a lot of credibility because they see the real-world consequences of not doing anything. They see people suffering unnecessarily and the strain it puts on the whole healthcare system.
So you've got the public getting louder healthcare professionals raising the alarm, and the media keeping this story in the spotlight. That's a pretty powerful combo.
It is,
Yeah.
and it creates a chance for things to change. Remember, this policy isn't a law or anything. It seems more like something they decided internally.
So it could be reversed, right?
Exactly. If there's enough pressure from the public and from doctors,
Mhm.
and if the media keeps paying attention, the Louisiana Department of Health might have to rethink what they're doing.
Like a tug of war. And right now it seems like the side that wants to actually do something about preventing the flu is winning.
It could happen. And if they do change course, it would be a great example of how people working together can change public health policy for the better.
Yeah, it shows that we're not helpless, even when decisions don't make sense. We all have a voice, and we can use it to push for policies that protect our communities and keep people healthy.
Well said. This whole situation really shows how important it is to stay informed and to talk about these issues and to hold our institutions accountable, to make sure they're making decisions based on facts and what's best for public health.
So what about you listening at home? What can you take away from this deep dive into Louisiana's flu season?
I think the main thing to remember is that public health is everyone's responsibility. It's not just up to the experts or the people in charge. It's up to all of us to learn about these things and talk about them and advocate for policies that keep our communities safe.
And remember, this goes beyond just the flu. This is about a trend of people questioning science and not trusting experts and putting individual choice ahead of what's good for the group.
These are complicated issues with big consequences, and we need to think carefully about them and have real discussions.
Here's something to think about. As we face more and more complicated health challenges in the future, like new diseases and the effects of climate change, how do we balance personal freedom with the need to work together? How do we make sure public health policies are based on science and evidence and not just opinions or fear? That's a question that's going to keep coming up in the years to come.